For the next session, it's an honor and a great privilege when you get to introduce your own teacher to take the stage. I'd like to call Professor Dr. Rauf Niazi, former head of the department, Shahid Zulfikar Ali Bhutto Medical University, Pakistan Institute of Medical Sciences, my teacher, my mentor, who's going to be talking about obesity and the risk of cancer. So, sir, over to you.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. It's really an honor to be on this stage of Pakistan Society of Internal Medicine. And I'm a lucky person that the society chose me as the chapter president of Islamabad for the same society. So it's an honor. And what do you all see? Light. Wake up. Wake up. So it's a lightning round. I shouldn't be wasting time. I'm supposed to finish in time. Obesity and cancer. So we know obesity is a disease in which a person has unhealthy amount and or distribution of body fat. Now we measure obesity in terms of fat accumulation as well as distribution. So the criteria, the things we use are waist circumference, the waist to hip ratio, the waist to height ratio, and obviously we can use the DEXA scan, PET, CT to measure the distribution of the fat. Now, these measurements reflect not only the distribution of fat, and they are used along with BMI as indicators of obesity and the disease risk. There's more and more interest in accumulation of fat in the visceral tissue. We know that when we accumulate fat in the visceral tissue, that leads to pathogenesis not only of diabetes, but also of certain other diseases, which I'm going to talk about. It's an epidemic. And we know obesity is on the rise. It's the lifestyle we are leading. Sedentary. Everybody is busy. No exercise. Eating more. Lifestyle modification needed. And this is, I'm sorry, an old chart showing how obesity has progressed in the countries between 1990 to 2013. I'm sorry, it's an older data. I do not have the recent data, but you can see a humongous rise in terms of obesity in almost all the countries. And surprising is Pakistan, although with a lesser population, is on the rise, about 22.1% increase in obesity. So when you think about obesity, what do you think? Obese patient would have difficulty walking about, maybe get plantar fasciitis, maybe get osteoarthritis, knee pains, varicose veins, inguinal hernias. We'll talk about metabolic disorders, hyperlipidemia, hyperglycemia, hyperuricemia, hypertension. Then going on to obviously the consequences, heart condition, renal failure, talk about fatty liver, MASLD, the metabolic syndrome associated liver disease, mechanical problems, heart failure, strokes. So I can go on, but these are things we all know. We know that diabetes, obviously obesity leads to, I'm looking at the time, okay. Obesity leads to cancers. There is an increased risk of cancers as well. This is one thing we do not talk about. And I'm just going to briefly touch the mechanisms involved which can possibly cause the association of obesity with cancers. So we do know that when we accumulate fat cells, both in females and male, in males, the testosterone is in the fatty tissue converted into estrone, which is excess of female hormone, and in females, the estrogen levels go high. And both in males and females, this leads to increased risk of breast cancers, and in females, both of endometrial and ovarian cancers. People with obesity often have increased blood levels of insulin and insulin-like growth factor. So we know type 2 diabetes is associated with insulin resistance, and that insulin resistance causes more insulin to come out. So we already have excess of insulin in the body. Now that excess of insulin has effect along with its growth factor, that is IGF-1. It attaches to the cells and leads to its apparent growth and maybe a risk factor in causing cancers. People with obesity often have chronic inflammatory disorders like gallstones or MASLD, which obviously cause oxidative stress and cause changes in DNA or damage to DNA, which may further lead to the obvious consequences. Professor Ubaidullah, the obvious consequences, that is malignancy. Now we do know that there are adipokines present in the body. When you have excess of fat cells, unfortunately, the two major adipokines, leptins and adiponectin. What happens to leptins? It becomes mutated and has more excess in the body. And this leptin causes, obviously, increases with increasing fat, body fat, and leptin can promote proliferation of apparent cells. And that can lead to, obviously, the disastrous consequences. While adiponectin, which is the good hormone, or the good, obviously, adipokine, it has an anti-proliferative effect. So in obesity, we get more of leptin and less of adiponectin. Fat cells may also have a direct or indirect effect on other cell growth and metabolic regulator, like mTOR, the mammalian target of rapamycin, and also AMP-activated protein kinase. And if I'm not going to go into detail of biochemistry, but these obviously are regulators, metabolic regulators, and can be one of the causes of cancer, more cancers in obese patients. The impaired tumor immunity and the changes in the mechanical properties of scaffolding tissue in and around or surrounding the tumor is changed. So the tumor is more likely to easily spread. In addition, there are mechanical difficulties, and that I'm sure all of you would understand. The more obese patients are less likely to be screened for cervical cancers, and they are more increased in with obesity. What cancers do we get with obesity? I can start from meningiomas to thyroid cancers to adenocarcinoma, the esophagus, go on to the stomach. Stomach carcinoma is increased, pancreatic, gallbladder, liver, the kidneys, colon, and you talk about ovaries, endometrium, prostate, and multiple myeloma. All of these cancers are increased in patients who are obese. So obesity is just not a metabolic disorder. Remember, obesity is a serious disease with serious consequences. Not only metabolic, but you are predisposed to cancers. Most of the data, now, does losing weight, what if we lose weight? Would it increase or decrease our risk of getting cancer? We do not have very good studies, but whatever data I could get, most of the studies were either cohort case-controlled studies or observational studies. And the observational studies have to be taken very carefully because they cannot be interpreted in a right way. But some of these studies found out that decreasing the weight would lead to decrease in chances of getting breast, prostate, and endometrial cancers in females, and in males, it reduces chances of getting prostate cancers. In the Women's Health Initiative, they found out there was no change. But when the data was pooled from 10 cohort studies, a sustained weight loss was associated with lower breast risk among females 50 years or older. To better understand the relationship, patients who undergo bariatric surgery, we do know, all of understand they do lose weight, and there have been studies and they have been found that there is a decreased risk of not only endometrial, ovarian cancer, colonic cancer, but also in males, the prostatic cancer. So evidence is there. One research area which is very interesting in future, which people are working on in linking obesity to cancers, is the gut microbiota or the microbiome. It has been seen in both type 2 diabetes and obesity, there is dysbiosis, an imbalance of community of the microbes. For example, the gut microbes in patients who are obese differ from those who are slimmer and healthier, not only in terms that they are less diverse, but also different. Less diverse and different. So that is something which is maybe a factor in leading to inflammation, altered metabolism, and genotoxicity. And obviously consequences you understand. And lastly, obesity alters the tumor microenvironment, which may play a role in progression of, obviously, the underlying dangerous process. In a study, the mouse who were made obese by feeding them on fatty diet, it was found there was a competition between T cells and the tumor cells. And the tumor T cells took up more lipids, and the T cells, they could not. And the T cells became less effective in combating the underlying, obviously, notorious or the apparent cells. Another area of research which is going on is the cancer cells express a special receptor which has more affinity, the insulin receptor, which in IRA, which has more affinity for insulin and its growth factor, so they can rapidly grow. If these two areas in future can be targeted, perhaps we'll have more understanding and more mechanism to address these issues and maybe put a stop to some of the cancer which are associated with diabetes, with obesity. So I'll end my talk here, and thank you all for being a very, very patient and very good audience. And if there are questions, I'm ready to answer later.